is the case of muscle laceration or muscle sprain in a dog. The dog that was the Labrador dog, and the this case was presented at our Sivas clinic with the history of lameness and exaggerated movement of the l- hind limb. It is the one hind limb that was having exaggerated movement, and the movement was not balanced. And particularly, that during the time of the movement, uh, the animal was not able to properly adduct adduct its limb. So it means that some muscles which are responsible for adduction or adduction of the hind limb, they were affected. So that particular case was clinically examined, and after a digital manipulation or of a thorough examination, it was the concluded that the medial thigh muscle and some medial thigh muscles, mean those are called the adductor muscles, like the gracilis muscles, the pectineus muscle, the gastrocnemius muscles. So one of these muscles, these are the muscle which are commonly affected, which are commonly strained or affected or traumatized in dogs, and particularly those breeds of dogs which are used for sports purposes, like the greyhounds. So these greyhounds, they are very commonly affected, and similarly during sudden movement or jumping or sudden taking turn during excessive movement, these muscles, they get teared off, they get traumatized, and ultimately you will feel the sprain or laceration of these muscles, which are causing hindrance to the normal movement of the hind limbs. So I will be discussing one of these case, the breed of the dog that was Labrador. And laceration, that the laceration, these are the irregular injuries, either the skin laceration, and that is the type of the wound in which the edges, they are not regular. The muscle laceration, that is the traumatization of the muscle, in which the direction of the trauma, that is not regular. So once the animal that is suffering from muscle traumatization or lacerations, so the natural healing process starts, but it depends upon the severity of the laceration. So we can, on the basis of the breakage of the fiber or muscle fiber, we can divide the severity into three categories. Mean first degree laceration, mean when less than 25% fiber of the affected muscle, they are traumatized. If the if the breakage of the muscle fiber is up to 50%, so we can say that this is the second degree laceration. And if the breakage is more than 50%, so this is the third degree. So the third degree is much worsening, and in which the chances of the healing, that is very much graved. But in case of first degree muscle uh, trauma or muscle laceration, the chances of the healing is good, the chances of the recovery and the chances of the rehabilitation and the movement of the animal, that is good. So that's why the process, healing process, that start with the start of the bleeding. I mean, when there is a rupturing of the muscle, definitely the muscles, they all are supplied with the blood vessels, and these blood vessels, they also get ruptured, and there is a bleeding, development of the hematoma at the level of that muscle. After that, the inflammatory process is started, and it will definitely catch the attention of different inflammatory agents, factors, and cause the inflammation and cause increase in the size and cause the swelling of that affected part. And that area become hot, that area become more painful, and that because of that painful condition, the animal that would not be able to properly keep the foot or keep the limb, affected limb, at its right position. The next step of the healing is the proliferation, and after the inflammatory stage, the proliferative stage starts with the involvement of certain fiber secreting cells like fibroblast. So these cells, they will get activated and they will release the fibers, like the thick fibers, the elastic fibers, just to fill up the gap, the traumatic gap. And finally the remodeling phase, in which if there is excessive proliferation of the tissues, so these tissues should be adjusted according to the normal posture of that area. So what we have a plan in our mind while we are dealing the case of the muscle traumatization in a dogs or in animals. Like our first strategy would be that we have to place that animal at full rest, because the rest is the best treatment, because it will allow the tissues to proliferate, and it will allow all the healing factor to come, and the rest, that will not further be disturbing to cause further expansion in the trauma. If the animal is not properly at rest, so definitely the level of the trauma could be increased, and it could be become more worsening. So that's why the healing, for promote a very good healing, proper rest plan should be offered to that particular animal. The next very emergent and the urgent step would be that we have to reduce that acute phase of inflammation, because during this phase you will see there is a swelling, there is a painful condition, and the this inflammatory phase that should be reduced by using some ice packs. That is a good way to cool down the inflammatory response for 20 minutes. And the next step would be the application of some compression bandages. The best advantage of the compression bandages would be that it will give a very less space or accumulation of the exudatory material. So that's why some elastic bandage or compressive bandage, they are also offered. They are also wrapped along, just to reduce the space. That space could be used for accumulation of the exudatory material or inflammatory exudation. So the dog breed was Labrador, and color of the dog was white. Age, weight, that was around about 40-50 kg. TPR of that animal was normal. Hydration was also normal, and so the owner name was Muhammad Ashraf. The Ashraf belongs to Barwana, and this is its mobile number. The history of that particular case was the animal was ran behind the animal for hunting, and that case was around about 2 months, week older. And during that running or aggressive running or aggressive movement, the animal fell down, and ultimately it resulted into tearing of its one of medial thigh muscles. And the animal that was having exaggerated movement, particularly when the adduction process of the hind limb, that was not okay. And it was on the basis of clinical signs, on the basis of the animal that was also having the second degree lameness, that when the animal to walk, in the lameness that was observed quite clearly. And so after clinical examination, after thorough clinical examination of the affected area, or focal clinical examination or physical examination, the one of the muscle of the medial thigh, that was diagnosed as inflamed, because the size of that affected muscle was increased. It was painful response, and it was concluded that this muscle that was teared, that was traumatized. So that case was on the basis of our clinical diagnosis. That case was diagnosed as gracilis muscle tear or trauma. So this is the particular case, and this was our diagnosis, that on the basis of clinical examination, the gracilis muscle tear, that was. So if you look at the medial thigh muscles, you can see the caudal thigh muscle, big caudal thigh muscle, so that is more affected in the sports, in these sports animal. So that is the gracilis muscles, gracilis. And when we palpated this area, so that was affected, that the animal was showing the pain response, and there was an increase in the size of the muscle, and we also felt the excessive fibrous growth over that area. So along the gracilis muscle, that is a very smaller muscle which is hidden inside between the gracilis and the sartorius muscles, that is the pectineus muscle. This muscle is also affected in greyhounds, but in this case, this muscle seems to be okay. The next muscle, these are the sartorius muscles. They can be, this is the gastrocnemius muscles, and this one is the sartorius muscles. All these medial thigh muscles, they can be affected whenever there is a, the sudden movement of the animal, or there is a sudden turn during the movement of the animal, particularly during the time of the hunting. This sort of injuries, uh, they can be diagnosed, or they can be happened. So we offer this treatment to that patient. We we give Flogen cream, that is the anti-inflammatory cream containing diclofenac sodium, and that was massaged on that, so just to reduce the painful response over that affected site. Similarly, we often this injection pins that contain nelbofene hydrochloride. This is the opiate analgesic, because the animal that was having a very huge painful situation and condition at that time, to reduce the pain. Similarly, just to boost up the muscle healing process, so we also give injection methicobal that contain vitamin B12, and that is a very good muscle healing promoter, and also vitamin E capsule that were also offered to promote the healing process and to promote the muscle tissues over that side healing area, and just to end up with a successful recovery. So after a period of 1 month, we also take the history of that patient. We consulted, and the animal that was having a very good improvement in the movement, in exaggerated improvement. So this is all about this case number one. That case was about the muscle laceration or sprain of the gracilis muscle of the dog. This is your second case, and this is the case of sharp molars in equine, in a horse or in a mare. So this case was also presented at your clinic, and it was taken up by a student. So this is about the history of the case, or signalement in this the case number, the species, breed, gender, that was female, pregnancy status was non-pregnant, age of the animal was 12 years, color, that was brown, weight of the animal was 170 kg, temperature was 100 Fahrenheit, pulse was 35, respiration rate was 12. So that particular animal has the history of this quitting. Uh, on the different areas. So this is इस तरह जो नस्वार वगैरह रखते हैं, they just throw out the material from their mouth. So this is ours when it is suffering from sharp molars, or a problem of the irregular molars. So the animal will from the oral cavity, they are thrown out. So this condition is called quitting. So the semi-masticated balls of the food, they are thrown out from the oral cavity. So this sign, that is called quitting. So that particular patient that was presented at your clinic with the main complaint of quitting, the owner told us that this animal take the food, but after mastication, it threw out the balls of the semi-masticated food material. So this sort of clinical sign is closely associated with the condition in, that is the sharp molar. So if the molars, if the edges of the molar, if the outer and the inner border of the molar, if they become irregular or if they become sharper, so this sort of clinical signs that would be there. If you look at the anatomy of the oral cavity or the mandible, or, so the lower mandible, it is narrower as compared to the upper maxilla or upper mandible. So you cannot face, this is the table surface of the lower molars. This is the table surface of the upper molar. And these molars has two borders. This border is the outer border and this border is the inner border. And similarly, this upper molars also have outer as well as this one is the inner border of, and this is the outer border. So during the mastication, there is a no direct contact of the table surfaces of the upper molar with the upper molar with the lower molars. So usually these borders, the inner border of the upper molar and the outer border of the lower molar, they usually have more contact with each other. So that's why, so these areas, they are under direct contact, so that's why they remain smooth. But the outer border of the outer border of the inner molar, inner border of the inner border of the lower molars and the outer border of the upper molars. So they don't have a direct contact with each other. Their surfaces, they are not coming contact with each other. So that's why these surfaces, they become irregular, they become more sharper, and ultimately they can cause trauma to their neighboring tissues. Say if this surface or this inner border of the lower molars, if it becomes sharp, so ultimately it will cause trauma to the tongue. And the animal that is masticating, so it is causing more trauma or laceration because these are more sharper, and the tongue that is having a direct contact with the surface, it can cause the laceration. And similarly, in this case, the outer border is sharp and it is traumatizing or traumatic to the cheek. So that's why these two softer structures, they are under high threat when the animal that is having sharp molars, and particularly the inner and the outer border of the molars, they are sharp, they are irregular, they are not smooth. So, so as a result of this abnormality, what happens that the animal that this situation cause hindrance to the normal mastication because of the painful condition, that it can cause the trauma to the tongue, it can cause trauma to the cheeks. The animal try to masticate the food, but because of the painful response of this area, the animal would throw the semi-masticated balls of the material outside. Similarly, there is another response, or there is another very clinical sign which can also enable you to diagnose the case of the irregular molar, that is called tobacco pouching. Tobacco pouching means if this molar is affected and it is responsive, it can cause trauma to the cheek. So to prevent this action, animal would try to store these balls in the area between these molars and the cheeks. So animal would try to keep the food content between the cheek and the molars to save the laceration or trauma or traumatic effect of these irregular molar with the cheek. So you will also observe this sort of clinical sign in these cases. So this is called tobacco pouching. जिस तरह के लोग पान रखते हैं और एक बड़ी पाउच सी बनी हुई होती है, इस तरह नस्वार रखते हैं, एक बड़ी सी पाउच बनी हुई होती है उनकी चीक्स या लिप्स के दरमियान. So same situation happen in these animals. The animal, they would be keeping a balls of their semi-masticated feed between cheeks and their molars. So that is called tobacco. So these are the two clinical signs. One is quidding, another is tobacco pouching. So that can be observed. So in this case, both the clinical signs Uh, the clinical examination or symptoms the were observed that were imperfect grinding of the food. There was a tobacco pouch, and there were injuries that were found at cheeks and tongue, and there was a difficulty in mastication, an animal having the sign of the quitting. So here you can see the animal that would be throwing the balls of the semi-masticated feed. Here this condition is called quitting, and similarly this is called tobacco pouching. The animal would try to restrict or retain these food material between the cheeks and the affected molars. So that is called tobacco pouching. So what we should do in this case when the animal that is suffering from the irregular molar? So we have a particular instrument that is used for making the smoothness of the irregular surface of the molar. So that is called tooth rasper. And this application of the tooth rasper, that is called tooth rasping or tooth fluting. So uh, different types of the tooth rasper, that electrically tooth rasper as well as the manual tooth rasper or floater, they are available. They are applied on the irregular surfaces of the molars, and that molar surface is made smooth. Their sharp edges, they are smooth down, and ultimately the animal can get relief from the traumatization. So this sort of practice, that is called rasping of the irregular molar. So this case, that was your second case that was presented at Sivas Clinic, and that is being discussed with you. For this condition, we can also use the painkiller just to reduce the pain response, and some tonic that was also recommended by the students just to improve the uh, feeding behavior of the animal.